over 90% of the mortality rate in cancer patients can be attributed to secondary cancer cells. IMEC's developing a compact and user-friendly device to sort and analyse cancer cells. This allows for metastases to be discovered more quickly, which is crucial for patients to survive.
Cellsorter is a device that we are developing that will help oncopathologists and nurses to follow up cancer patients during their disease. Already billions of euros have been spent on trying to detect and to treat primary tumors, but also metastatic tumors. Little attention, however, went to the process of metastasis. The process of metastasis is when the primary tumor, for example the breast cancer, sheds the tumor cells via the blood to the entire body, and it's actually that metastatic process that makes treating and curing cancer so difficult.
A metastasis is caused by circulating cancer cells, creating new tumours or secondary cancers elsewhere in the body. Finding these roaming cancer cells is like looking for a needle in a haystack.
For every circulating tumor cell, there's 1 billion of healthy blood cells, so it's extremely difficult to find the circulating tumor cell, and the current methodology is very complex with many steps, many different instruments. It's impossible to implement that in clinical practice. A method that can be used in clinical practice needs to be fast and efficient.
The device that IMEC wants to develop is based on chip technology. Digital image processing replaces the optic lenses, so that a large number of microscopes can be used at the same time to track these rare circulating cancer cells.
Thanks to the power of miniaturization of computer chip technology, we can make 1,000 tiny channels over an image sensor, and when we flow the blood through the channels, we can make images of individual blood cells. And in that way, we can screen 100,000 cells per second or even 1 million cells per second microscopically. We can detect the red blood cells, the different types of white blood cells, but of course also the abnormal cancer cells.
Thanks to IMEC's research, cancer metastases can be discovered earlier and more efficiently, significantly increasing the patient's survival chances. The development of the PCR chip is another breakthrough innovation in the treatment of cancers. This chip can check your DNA for the odds that you may develop, for example, breast or colon cancer, or it can quickly see whether you contracted a certain infection.
This PCR chip is a magnifying glass for DNA. We can use it to look for genetic markers, or we can look for infections like hepatitis C, HIV, Ebola. In the future, what we'd like to do is, during a routine consultation with a doctor, perform a complete blood analysis with this device.
Today, for example, to check for Ebola, a blood sample is necessary. But the result of the test is only available after 1 day. Thanks to chip technology, the test results could be available within 15 minutes.
Well, after further development and validation, this device will be available to the consumer within about 5 years. At that moment, it will be possible to perform a very complete blood analysis using a method that's very similar to a pregnancy test today.
This technology will allow us to monitor our health more accurately and much easier and simpler than is possible today. The impact on the healthcare system will be significant.